Hello, this is your girl Renee, and I just had a session with two older ladies, and it made me realize something that once per year I can't be talking about this. Once per year ain't cutting it. The reality is, all of us women, regardless of what age we are, your pelvic floor muscles, your puss, you definitely need to be doing work on that. I will say as soon as women become sexually active, your pelvic floor muscles needs some work. So the same way that a lot of us women are so concerned about cardio and want to know how to do more cardio and doing this and that, it should be in the same, this exercising your pelvic floor muscles should be in the same category of your quote unquote obsession or think about doing cardio. The reason being, let me break it down for you. Let me sit down here. So your pelvic floor muscles do a lot. You might not be thinking that they do a lot, but actually they do a lot. So as you go through the different stages of the female life cycle, for those of you who have had children, your pelvic floor muscles have to bear that weight. Your pelvic floor muscles take a beating sometimes, if you know what I mean. Take a beating in terms of you having to deliver a child and you having to push out a child. And they still have to recover. So thinking of exercising your pelvic floor muscles and preparing for pregnancy, that's one thing. Then postpartum period, where you're trying to recover, hormones are doing all different sorts of things. Again, your pelvic floor muscles need to recover and they need to have proper rehabilitation to do that as well. Then, as we get older, you know they say if you don't use it, you're gonna lose it. The same thing applies to your pelvic floor muscles. So let me do an analogy. If you don't use your arms, you know that they're going to start to get soft, they'll look deflated, they're not going to be contracting, and they're not going to be able to sustain weight, anything like that. Your pelvic floor muscles, the same thing happens. They are muscles. For all the ladies watching, for all the men, thank you for being on, because there's some of the information that can benefit you as well, if you know what I mean. Right. So your pelvic floor muscles need to make sure that you are continuing to strengthen that, because the reality is, right, a lot of older women, especially women, suffer with some type of incontinence, whether it be urinary incontinence, that you can't hold your urine, whether it be, so you call that stress incontinence. Urge incontinence is that you constantly having the urge to urinate and you really can't hold it. You can have fecal incontinence, where you can't hold a fart. Hi Sam Sweets, where you can't hold a fart, where you can't hold in your shit. All of these things start to appear when you get older, and the reality is they can be prevented. You do not need to be supporting and spending money on incontinence pads and adult diapers, because the reality is some of them things is cost real money. I could tell you a pack of incontinence pads, I think probably about 10 to 15 in a pack, could run you about $15 to $20. It might be less than that. And how I know this, if y'all didn't know, I don't have her anymore. My sister is her main caretaker, paralyzed cat. Her name is Rainbow. When she was younger, we had to use incontinence pads with her, so that because she was just leaking urine, she did not have any control of it. So the same thing can happen to you. So going back to your pelvic floor muscles also help to keep your bladder, your uterus, and your rectum in place. If you don't strengthen them, those can actually push into the vagina And then we're going to show you what the vagina is, because what we call the vagina is actually the vulva, everything down there. The vagina is actually the tube where a penis, tampon, or blood comes out of, or a baby comes out of. That canal is your vagina. So you can have things like your uterus collapsing down into it. You can have your bladder bulging into it and making that space a lot smaller and making other things painful. You can have your rectum bulging into it, again making that space smaller. So that's why it's important for you to take care of your pelvic floor muscles, exercise your pelvic floor muscles. Now, on the other hand, if your pelvic floor muscles are too tight, doing Kegels and trying to strengthen them, that's going to make it worse. So that's like if you have your shoulders shrugged up here and you're trying to do shoulder shrugs, it ain't gonna move, nothing ain't moving. So the thing is to relax your pelvic floor muscles. And the only way you can know if they are tight or if they are slack or loose is if you get assessed properly. So when you're seeing all these commercials telling you, oh, you got to strengthen your pelvic floor muscles, you got to do Kegels and things like that, do not do them until you get evaluated first. But most of the times, a lot of us having issues with holding urine, holding feces. So you see this? This is super important for you to pay attention to, because you cannot see it, you don't think about it until things start to happen. And I would say for my ladies out there that have started perimenopause or are heading towards perimenopause, and your body starts to prepare for that around age 35, taking care of this here is going to be super important as well. So you might be seeing more of me offering more programs. One of the programs I offer is Pelvic Pulse, and I typically just do that once per year, like in September. But I realized from this evening that it is something that is needed. It is not a situation where I should wait on somebody to ask me about it to do it. So going forward, a lot of things that I do will incorporate this. And yeah, pay attention to it. You don't want to be spending money on incontinence pads, spending money on adult diapers, spending money on different things, feeling embarrassed, or thinking, oh shoot, I don't have on my liner or pads so I can't exercise, feeling uncomfortable. It is not a death sentence. A lot of these things can be reversed. It's just that you need to have the proper guidance and the proper information in terms of what to do. So, yeah, that's me. If this information has been helpful to you, let me know. And I will talk to you all later, because this was just an impromptu live. So I can talk to y'all later. I gotta go and bring down everything after this session that I had. And yeah, have a good evening. And thanks for listening. Bye.